Assalamu alaikum, a very pleasant good day to one and all. I am Farhina Afroz Tanha, Brand Executive, Chronic Care Team of the ACME Laboratories Ltd, welcoming you all in today's scientific seminar on diabetes breakthrough, the unique combination of Empagliflozin and Linagliptin for diabetes management. We are pleasingly delighted to have you all with us to participate in this scientific session, which serves as a reminder to us that how important our work is for the advancement of Bangladesh's health sector. We are thrilled to have the esteemed National Professor Dr. A.K. Azad Khan Sir as the respected chief guest amongst us. We express our heartiest gratitude to Honorable Professor Firoz Amin Sir as the respected chairperson of today's session. We earnestly acknowledge our special guest, Professor Muhammad Farooq Pathan Sir's blissful presence amongst us. Professor S.M. Ashafujaman Sir, we are very much grateful to have you as the guest of honor of today's program. Our sincere gratitude goes to the revered panel of experts, Dr. Faria Afsana ma'am, Dr. Shahana Parveen ma'am, Dr. Qazi Nazmul Hussain sir, for your support and participation. Today, the session for which we are eagerly looking forward will be conducted by Dr. Sultana Rehana Akhtar and Dr. Rushda Sharmin Binte Rauf ma'am. Last but not the least, our heartiest appreciation goes to our moderator, Dr. Parijat Ghosh, for her relentless all-out effort. While this conference is specifically about diabetes management, we strongly believe that strategies and solutions we adopt here will be helpful to reverse the ever-increasing number of diabetic patients by proper treatment. Without any further ado and with the permission of the respected chief guest and chairperson, I would like to invite Mohammad Mahabubur Rahman, Group in Charge, Chronic Care Team, the ACME Laboratories Ltd, on the stage to say a few words for us. Thank you.
Assalamu alaikum everyone. It is my great pleasure to address today's scientific session on diabetes breakthrough, the unique combination of Empagliflozin and Linagliptin for diabetes management organized by the ACME Laboratories Ltd. Before we get started, I would like to express my sincere appreciation to the respected chief guest, National Professor A.K. Azad Khan Sir, special guest Professor Muhammad Farooq Pathan Sir, guest of honor S.M. Ashafujaman Sir, chairperson Professor Firoz Amin Sir, our panel of experts Dr. Faria Afsana ma'am, Dr. Shahana Parveen ma'am, and Dr. Qazi Nazmul Hussain sir. Our today's speaker, respected Dr. Sultana Rehana Akhtar madam, Dr. Rushda Sharmin Binte Rauf madam, and respected moderator Dr. Parijat Ghosh, and all the esteemed doctors who generously helped us to make this event come together. We all are here together because we share a communal belief and passion that to avert the pandemic of diabetes. One of 10 adults are currently now living with the diabetes named sugar curse worldwide. New figures from the 10th edition of the IDF Atlas shows that 537 million people are now living with diabetes. Therefore, it's high time to update our diabetes knowledge and skills so that we can prevent and help millions of people to win the battle of diabetes. The ACME Laboratories Ltd is one of the largest and accredited pharmaceutical companies for making world-class and top-quality medicines since the very beginning. ACME is continuously working together to ensure health, vigor, and happiness by providing the best quality medicines with USDMF grade CEP grade raw materials, which is manufactured in the TGA and UKMHRA approved facilities. We ACME family is relentlessly working to help the people to fight off this diabetes beast by raising awareness against it. Without further ado, and with this positive mission, let us start the main event. It has been an honor to be among such accomplished personals and to be able to present my perspective before you all. Thank you and a very good day. I am requesting the host to take over. Thank you very much.
Thank you so much, Muhammad Mahbubur Rahman, for your delightful commencement. Now, with the permission of the chairperson and chief guest, I am requesting our honorable moderator, Dr. Parijat Ghosh, to officially start the scientific session.
Thank you so much for giving me the floor. Assalamu alaikum everyone. This is Dr. Parijat Ghosh, MD Resident Phase B, Department of Endocrinology, Bardem General Hospital, will be the moderator for today's scientific session. I would like to direct my heartiest appreciation to ACME Laboratories Ltd for arranging such an enriched knowledge sharing program from where we as physicians can be hugely benefited. And with this session, we can help numerous people who are battling against diabetes every day. Our topic for today's scientific session is diabetes breakthrough, the unique combination for diabetes management. In today's scientific session, we will elaborately discuss about the role of empagliflozin and linagliptin in diabetes treatment. But first of all, I would like to invite our honorable special guest, Professor Mohammad Farooq Pathan sir, Director Bardem Academy, on the podium for his short brief about today's scientific topics. Let's give a warm welcome to Professor Mohammad Farooq Pathan sir.
Respected Chief Guest, Professor A.K. Azad Khan, National Professor and President Baras, my beloved Chairperson, Professor Firoz Amin, Head of the Department of Endocrinology, Bardem General Hospital, my another colleague, Professor A.K. Ashrafuzzaman, one of the leading professor in the field of diabetes and endocrinology and the President of Bangladesh Endocrine Society. And the speakers, two speakers, and all the participants in front of me, Assalamu alaikum and good afternoon. As you know, in the field of diabetes, particularly type 2, is a very, very complicated and complex phenomena in the development of hyperglycemia and consequences. Before 50 years back, we little know about the pathophysiology of type 2. As days gone, lots of evidence and data are in our hand, which shows that the pathophysiology of type 2 in the form of development of hyperglycemia is a complicated and has lots of pathways, which is called luminous octet pathway for the development of hyperglycemia. So in each defect in the pathway, needs some special medication to control the hyperglycemia and maintain it. In a type 2 diabetic patient, not only the beta cell dysfunction and the insulin resistance is not the only culprit. There are other pathways also take part in this regards. So in type 2 diabetic patient has multiple path defect in the pathways, and each pathway needs specific anti-diabetic medication. So if we count it, maybe 8 or 10 anti-diabetic agent may be required if you have a patient has 8 defective pathways. So lots of medication is required, and not only that, type 2 diabetic patient also have some of the medication like anti-hypertensive drug, anti-lipid drug, anti-obesity drug, different type of drugs patient has to take. So lots of medication, cost is high, and in this form, this is not only the 8 or 10 days or 2 weeks treatment, it is a long life treatment. So compliance and adherence is important, dropout is also important. With this objective, the pharmaceutical companies and all the leaders in the field of diabetes thinks that if we can combine, make a fixed dose pill, may alleviate some compliance and the adherence in the management. So fixed dose combination drugs is in the market now. In this regard, Jardians, this is Empagliflozin, what is the brand product of the Beringer is our hand in the market, and local companies are making it1. On the other hand, Linagliptin also in our market. So two drugs can help the patient, because nowadays, if you consider cardiovascular benefit and everything, renal benefit, so patient is a good combination of the empagliflozin and linagliptin is important for that reason, and it will help the patient if the fixed dose combination is there, and compliance will be more. That's why this good combination is important for this respect to improve the compliance, adherence, and also as well as the cost. I think so ACME has done the right way to bring this combined molecule together, this empagliflozin and linagliptin together. But one thing you mind that, as we know, the linagliptin does not require any renal function to test to initiate and maintain the drug. In any renal impairment stage 5, also you can give the linagliptin. But you have to mind, when you add the empagliflozin together, you have to think about the EGFR and renal function test. So not write that any patient you can write the linagliptin, but when you write the empagliflozin, must have to assess the renal function. In this regard, when you do the combined treatment, then you have to definitely assess the renal function before start the combined pill. Thank you very much for giving me the floor.
Thank you so much, sir, for your exceptional speech. Now I would like to invite our first speaker, Dr. Sultana Rehana Akhtar Madam, Deputy Chief Medical Officer, OPD, BARDEM, on the podium to conduct the session on linagliptin and empagliflozin role in diabetes management.
Respected Chief Guest, Special Guest, Guest of Honor, Chairperson of this scientific session, and the dignitaries, Assalamu alaikum. I am Dr. Sultana Rehana Akhtar. Welcome you all to my presentation. My topic is role of empagliflozin and linagliptin in diabetic management. Diabetes is the global health crisis. It is one of the fastest growing global health emergencies of the 21st century. Among the top 10 causes of death is diabetes. Bangladesh is ranked 10 with 9.4 million people affected with diabetes in 2020. Let us have a look on pathophysiology of type 2 diabetes. Hyperglycemia is the biological hallmark of all diabetes. We know environmental factors triggers the diabetogenic process in genetically susceptible individual. In type 2 diabetes, obesity increases basal insulin secretion, causes impairment of beta cell to secrete meal-related insulin. It decreases the insulin action in muscle, liver, adipose tissue, and other tissues. It progressively decreases the beta cell function, thus increase postprandial plasma glucose, increase fasting plasma glucose, dyslipidemia, fatty liver, and all are vicious circle. In natural history of type 2 diabetes, earliest abnormality is insulin resistance without any glucose intolerance. Glucose intolerance begins with the appearance of IgG or IgT. Ultimately, it reaches the diabetic level with increasing glucose intolerance, increasing fasting and postprandial glucose, and decreasing insulin level. This is the ominous octet model. In 2008, Professor Rolf DeFranjo proposed an ominous octet, 8 factors that contribute to the pathophysiology of the type 2 diabetes. In pancreatic beta cell, decrease insulin secretion. In pancreatic alpha cell, increase glucagon secretion. In liver, increase hepatic glucose production. In brain, neurotransmitter dysfunction affecting appetite and metabolism. In muscle, decrease glucose uptake. In kidney, increase glucose reabsorption. In fat cell, increase lipolysis. In intestine, decrease incretin effect. And all are contribute to the development of type 2 diabetes. With a better understanding the pathophysiology of diabetes, newer antidiabetic agents are developing. In last 2 decades, Dpp4 inhibitor, SGLT2 inhibitor were developed, and still newer agents are coming. Dpp4 inhibitor allow improve the glycemic control by prolonging the action of incretin hormone GLP-1 and GIP. outstanding efficacy, safety, and tolerability of Dpp4 inhibitors make them an unique class of antidiabetic agents. Mostly available Dpp4 inhibitors are sitagliptin, vildagliptin, saxagliptin, linagliptin, allogliptin. Dpp4 inhibitors allow the endogenous GLP-1 to remain in circulation for a longer period. It is oral rather than injectable. It is weight neutral, associated with a low incidence of hypoglycemia or gastrointestinal side effect, and also improves some beta cell functions. Among all Dpp4 inhibitors, linagliptin and sitagliptin are not metabolized appreciably. Vildagliptin hydrolyzed to inactive metabolized. Saxagliptin hepatically metabolized. Route of elimination of linagliptin is biliary and others are renal. So, which Dpp4 inhibitor to choose? Regarding glycemic control, effectiveness of all Dpp4 are same, but considering the potency, efficacy, safety, and convenient profile, linagliptin is found to be superior. In a study, the glycemic control with monotherapy of linagliptin and combination therapy with metformin, pioglitazone, metformin plus sulfonylurea shown, it shows the combination of linagliptin with other drugs effectively lowers the HbA1c. All Dpp4 inhibitors are involved in outcome study. Safety observations are promising. No increased risk of cardiovascular event was observed in patients randomly treated with Dpp4 inhibitors. Among all Dpp4 inhibitors, linagliptin has 4 points of cardiovascular safety, that is no increased risk of CV death, MI, stroke, or hospitalization due to angina pectoris. Linagliptin is the first only Dpp4 inhibitor that does not require dose adjustment in renal patients, even in severe renal impairment. This is the unique property of linagliptin. So, linagliptin has proven efficacy and high cardiovascular and kidney safety profile. Now I am discussing on empagliflozin. This is the first antidiabetic agent which is very effective drug. In addition to lowering HbA1c level, it has several other beneficial effects in cardiovascular patients. If we look into the result of Empirec trial, when empagliflozin is added to the standard care in patients with type 2 diabetes who are at high risk of heart disease, empagliflozin led to significant reduction of total cardiovascular effect, including heart attack, stroke, heart-related death, reduction in hospitalization, in heart failure. In 2022, the FDA approved empagliflozin for the treatment of heart failure patients with preserved ejection fraction with or without diabetes. Emperor Preserve trial shows that treatment with empagliflozin reduced the relative risk of cardiovascular death or hospitalization for heart failure patients by 27% compared with placebo. In 2022, American Heart Association guideline for the management of heart failure recommend to add empagliflozin in stage A and stage B of heart failure. This slide is very known to us. This is the ADA guideline algorithm for 2022. The overall approach of glucose lowering medication in type 2 diabetes. In this guideline, ADA recommended SGLT2 inhibitor as a second-line therapy with established ASCVD or CKD. In case of without established ASCVD or CKD, compelling need to minimize hypoglycemia, Dpp4 inhibitor, and compelling need to minimize weight gain or promote weight loss, SGLT2 inhibitor is recommended as a second drug. In 24 weeks pivotal trial, Empagliflozine used as monotherapy and add-on to metformin, add-on to pioglitazone, add-on to metformin plus sulfonylurea, add-on to basal insulin. In all cases, it significantly reduces fasting plasma glucose. Higher dose has higher efficacy. In case of glycemic efficacy of postprandial plasma glucose, Empirgiflozine study in type 2 diabetes shows comparison with placebo, Empagliflozine reduces postprandial glucose significantly. In the management of patients with type 2 diabetes, we have a target to maintain BMI. In Empirgiflozine head-to-head sulfonylurea study, Empagliflozine compared with glimepiride, where glimepiride gained approximately 40% of body mass and Empagliflozine reduces more than 80% of body mass. In this result of Empirgiflozine outcome trial, Empagliflozine has cardiovascular benefit. It reduces 7 to 8% plasma volume independent of baseline and also reduces plasma pressure compared to placebo. So, robust indication for SGLT2 inhibitor are patients with overweight or obesity, hypertension, ASCVD predominates, heart failure or CKD predominates, and compelling need to minimize hypoglycemia. So far, we have discussed about details of these two novel drugs, Linagliptin and Empagliflozine, that are very effective and now in combination help to lower blood sugar. We are lucky enough now the combination of these two drugs are available in our country. Hope it will increases patient adherence. Thank you all for patient sharing.
Thank you so much, madam, for your exceptional session. Now I would like to invite our second speaker, Dr. Rushda Sharmin Binterov, madam, Assistant Professor, Department of Endocrinology, Bardem General Hospital, on the podium to conduct the session on case-based discussion on Linagliptin and Empagliflozine.
Thank you, Dr. Parijat. Bismillahirrahmanirrahim. Respected Chief Guest, Chairperson, Special Guest and Guest of Honor, panel of experts and my learned audience, Assalamu alaikum. At first, I'd like to express my gratitude for organizing this program and for giving me this opportunity to be here. I think most of the things have been discussed by my previous speaker. I'll try to highlight few points to ponder. I shall discuss a case that is actually very common in our daily practice. So this case you can see here, he's diabetic for 2 to 3 years, a 53-year-old male, and he's following his nutritional therapy and very regular in his exercise. He's on metformin, 1 gram twice daily, but recently his glycemic status is not very good. So he's very concerned about his glycemic status. his renal function and liver function is within control. So at this stage, we have to think about something good or something added here has to be the option. So what should be your option in this case? So if you think about the number one drug, that is if you want to choose sulfonylurea or not, or whether gliptins, or whether GLP-1 analog, or SGLT2 inhibitors or others. So if you try to analyze all these drugs, we can say that every drug has its own benefits and merits. At the same time, every drug has its own disadvantages or flaws. So if I ask every individual here, the answer will be different for individuals. And sometimes the decision is changed depending on the shared discussion with our patients. So the answer will not be the same for every person. So that is why the answer is very much individual for our patient, for our doctors. But as today's discussion is based on the combination therapy. So if we combine two drugs at a time, that is empagliflozin and linagliptin, so what is the benefit we are talking about? Is there any added benefit here? So to give the answer, let's look at study. So this is one of the study. They have combined empagliflozin and linagliptin as second-line therapy with inadequately controlled with metformin. And this study was conducted for 52 weeks. And here, the number of patients were more than 500, that is 686 patients were there, and it was an RCT. And there were 4 arms. Number 1 arm was empagliflozin 25 with linagliptin 5 milligram. Another arm, you can see, empagliflozin 10 milligram and linagliptin 5. An individual drug, that is empagliflozin 25 and linagliptin 5 milligram. In all 4 arms, there was longitudinal follow-up. And at 24 weeks, they have seen that, and they were assessed few points, including HbA1c and blood sugar profile, weight, blood pressure. And at 24 weeks, the result was like this. You can see here, all the arms there was reduction of HbA1c, but the greater reduction was with empagliflozin 25 with linagliptin 5 milligram in comparison to other all 4 arms, which was echoed in the same in fasting plasma glucose, in HbA1c reduction less than 7%, along with which is sustained up to 52 weeks. And the tolerability was well tolerated in add-on therapy with empagliflozin and linagliptin. But the question is why this finding is like this? Why the added drug was more beneficial in comparison to others? There is some exploratory hypothesis and discussion regarding this point, that is, they wanted to add here, when we are trying to add one drug, after one drug, that is 2 drugs is there, the HbA1c reduction is possible. But when we are adding 2 drugs at a time, that is triple drug at the same point, the sustainability of HbA1c is greater. So here the point is the sustainability. You can reduce the HbA1c with any one of the drug, but if you really want the sustained effects of the reduction of glycemic adverse effects, then you have to choose some easy drug that will be more adherent and easy to adhere. So this is one of the findings they want to explain here. Now, some few other points they want to explain why this was one of the greater combination in the initial aspect. They find out that if we try to combine empagliflozin linagliptin in initial combination, in that case, it can be a rational choice rather than the multiple drug to choose one after another, which will be needed after the natural, because of the natural progressive disease of the diabetes mellitus. Sometimes we face that one drug is added, after 3 months we have to add another drug, and ultimately patient go to the VAD failure. So to prevent that, if you try to add at the very first point that can address multiple factors at a time, then it will be more rational and logical to prevent the progression of the disease. And in this regard, they also find the beneficial effect in comparison to other forearms to reduce the HbA1c. And some other question is there when we're combining two drugs. The efficacy is same or not in vivo or vitro. So this is one of the references that has shown that the pharmaceutical condensity or intensity is same in comparison to human plasma. So in vivo and in vitro, pharmaceutical formulation is similar. So we are assured that it is similar in pharmaceutical formulation and human plasma as well. Another point is that we have already known regarding the action or mechanism of action of SGLT2 inhibitors and linagliptin. But what about the insulin sensitivity? Does it act on these two drugs, whether this will be an added benefit or not? We all know that SGLT2 inhibitors is a glucose offloader. And at that same point, it acts indirectly to reduce the insulin resistance. And at the other point, linagliptin acts on glucagon suppression. So they have found that it can increase the insulin sensitivity. By that, it will help to preserve the beta cell mass. Another direct beneficial effect on the pancreatic beta cell, though it is in the diabetic mice, but this result is also very exploratory and it is very convincing as well. So we have already discussed the anti-glycemic potency of the two combination drug. Now another case, you can see here the patient is 60-year-old female and she is on gliclazide and metformin. Here the problem is the early nephropathy. You can see here the urinary microalbumin is higher. So here the main point is to reduce the renal progression. So if we want to add here the two combination, what will be the benefit? So let's look some evidences here as well. So there is a study in comparison to metformin and insulin and linagliptin and empagliflozin. They combined two arms. One arm got the empagliflozin and linagliptin, where the other arms got metformin and insulin. And the result was like this. It was assessed by 3 parameters. Number 1, renal plasma flow. Number 2, glomerular filtration rate and intraglomerular hemodynamics. They assessed a Gomez model and finally calculated it, and the result was like this. Empagliflozin was significantly beneficial in the renal protection. Insulin acted on the preglomerular side. They hypothesized that, and SGLT2 acts on the postglomerular side. And by this mechanism, SGLT2 reduces the interglomerular pressure, as well as reduces the vascular resistance. So they concluded that empagliflozin can be a very good option for self-perpetuating cycle of renal and cardiovascular outcome that can be addressed by this combination. And what about the linagliptin? Linagliptin actually acted on this, has the highest efficacy to express the Dpp4. Not only that, it has the renal cell protective activity by anti-apoptotic, antioxidative and anti-inflammatory actions. So it has specific renal class effect independent of the glucose lowering efficacy. So linagliptin and SGLT2 inhibitors, if we combine these two drugs, actually the renal protection will be maximized. We can address two arms at the same time. We can reduce the albuminuria by SGLT2 inhibitors, and the renal cell can be protected by the linagliptin. So this is the mechanism. They have shown that these two drugs can be combined to reduce the renal progression. We have already known regarding the empagliflozin in the Empireg outcome study and Carmelina study by delaying CKD progression. These are the evidences already in our hand. This is also another important finding, that reduction of body weight was also very much beneficial or also effective in the empagliflozin linagliptin combination drug. The last case is the Mr. P, that is 46-year-old male, and he has acute MI 1 month back. So here the problem is the cardiovascular post-MI status. So it is one of the very common and important aspect that we are discussing in our daily practices, and we are actually very much concerned about this, because this is one of the pandemic situation that is most concerned regarding the mortality and morbidity issue that is more virulent in comparison to any other infectious diseases. So in this regard, what is the benefit if we combine linagliptin and SGLT2 inhibitors together? Let's see. So this is the mechanism we have already discussed. My previous speaker has been already point out very beautifully how actually these two drugs act. SGLT2 inhibitors, we have already known the mechanism of actions, and here the evidence is here. They have shown that the linagliptin and empagliflozin, if we combine together, it increases the cardiac systolic function in an ischemic reperfusion injury mice with diabetes mellitus. So the combination has some added benefits which will address multiple factors at a time, which can be a more protective mechanism, which can ensure a more protective mechanism to ensure more safety in cardiac disabled patients. So finally, I'd like to say that the individual drug has been proven its efficacy, and we are already very much known about this. And we are convinced about their efficacy, and beyond glycemic potency, they have their own benefits in the field of cardiovascular field as well as the renal protection field, and not only the glycemic potency. So if you combine the drug, it can be a safe and easy option to ensure the adherence. So just to ensure that efficacy and adherence, this is one of the options you can think about. Thank you very much.
Thank you so much, madam, for your valuable speech. So dear audience, now the question answer session. You can ask question if there is any queries regarding today's scientific session. If there is no question, I would like to invite our panel of experts, Dr. Kazi Najmul Hossain, Registrar, Department of Endocrinology, Bardem General Hospital, for his speech.
Respected Chief Guest, Chairperson, Special Guest, and Guest of Honor, and audience, Assalamu alaikum. And congratulations to Dr. Sultana Rehana and Dr. Rujda Shabin for nice and elaborate presentation on empagliflozin and linagliptin combination. And everything is discussed by the presentation. Actually, both the drugs are older drug. We are using this drug separately for a long time, but the combination drug is newer. Due to combination drug, the pill load will decrease and patient compliance will be better, and cost is also reduced. Both the drugs significantly reduce the HbA1c, and besides glycemic control, there are lots of benefit with empagliflozin and linagliptin. Both the drugs are weight friendly, especially empagliflozin, which significantly reduce the body weight, and risk of hypoglycemia is lower, and both the drug reduce the progression of chronic kidney disease. And as evident by the Empirgiflozine study, the empagliflozin reduce the hospitalization in heart failure patient and also reduce the cardiovascular mortality. So we can select the combination drug for the patient, especially who have cardiovascular disease and early nephropathy. And if the price will reduce more, the patient will be more benefited. Actually, this is a costly drug, so we have to judge the patient economical condition before prescribing. And thank you for ACME Pharmaceuticals for bringing the combination product and arranging the scientific session. And thank you, audience. Thank you, everyone.
Thank you, sir, for your valuable speech. Now I would like to invite our panel of experts, Dr. Shahana Parveen Madam, Chief Medical Officer, Bardem General Hospital, for her valuable speech.
Assalamu alaikum. First, I want to give thanks to our presenter. They present this combination drug elaborately. Most of our diabetic patients suffering from cardiovascular disease at younger age than non-diabetic patient. And several studies shows that about 70% diabetic type 2 diabetic patient died due to cardiovascular disease. Besides our lifestyle modification, we use different drugs in combination or with insulin for better control of blood sugar and better management of cardiovascular function and renal protection. This combination drug protects our cardiovascular function and renal function both. So, I want to give thanks for ACME company for bringing this breakthrough drug in Bangladesh, and which helps our to protect cardiovascular function and renal function of our diabetic patient. And thanks for arranging such scientific session. Thank you all. Assalamu alaikum.
Thank you, madam, for your nice and valuable speech. Now I would like to invite our panel of experts, Dr. Faria Afsana madam, Associate Professor, Department of Endocrinology, Bardem General Hospital, for her valuable speech.
Thank you, Dr. Parijat. Respected chairperson, special guest, guest of honor, and my co-panel of experts and all the audience, good afternoon and assalamu alaikum. It's my great pleasure and honor to be here as a panel of expert here, and in this regard I like to thank ACME Pharmaceutical for inviting me. Next, I like to thank the speakers, Dr. Sultana Rehana Akhtar, who briefly discussed the two novel drugs we are using for at least last 4 to 5 years, successfully in reducing the HbA1c and attaining the glycemic control. And next, I like to thank Dr. Rushda for presenting in front of us 3 beautiful cases. Actually, the cases we encounter in our daily practices, and highlighting the points regarding the importance of using linagliptin and empagliflozin in safety and efficacy regarding the cardiovascular complications. And these 2 drugs, linagliptin and empagliflozin, hopefully in combination act synergistically and be very helpful for diabetic patients, reducing the pill burden, ensuring the adherence and improving the compliance of the patient. And hopefully this drug will help us to achieve the glycemic control, as from different study we know that we are very far from the achievement of the glycemic target regarding the HbA1c, and hopefully in this way this combination drug will help us to achieve the glycemic target for our diabetic patients. Regarding this, I like to thank ACME Pharmaceutical and all the pharmaceutical who bring this product in Bangladesh and make the drug available to the reach of our diabetic patient. Thank you all. Thanks.
Thank you so much, madam, for your wonderful speech. Now I would like to invite our today's guest of honor, Professor Dr. S.M. Ashrafuzzaman sir, Honorary Senior Consultant, Ibrahim Cardiac Hospital and Research Institute, to the podium to enlighten us with short brief about unique combination of empagliflozin and linagliptin.
Thank you, Dr. Parija. আজকে সবার প্রধান অতিথি আমার শিক্ষক এবং জাতীয় অধ্যাপক প্রফেসর একে আজাদ খান স্যার, চেয়ারপারসন ডক্টর ফিরোজ আমিন, স্পেশাল গেস্ট আমার আর একজন শিক্ষক প্রফেসর মোহাম্মদ ফারুক পাঠান স্যার, বিজ্ঞ প্যানেলিস্টবৃন্দ, উপস্থিত বারডেম হাসপাতালের চিফ মেডিকেল অফিসার, ডেপুটি চিফ মেডিকেল অফিসার, সিনিয়র মেডিকেল অফিসার্স এবং অন্যান্য কলিগস বৃন্দ এবং হেলথ এডুকেশনের অ্যাসিস্ট্যান্ট ডাইরেক্টর সহ অন্যান্য অতিথিবৃন্দ, আসসালামু আলাইকুম এবং শুভ দুপুর। আমি প্রথমে একমি ফার্মাসিউটিক্যালকে ধন্যবাদ জানাই যে নতুন একটা কম্বিনেশন প্রোডাক্ট এমলিনো হিসাবে তারা এম্পাগ্লিফ্লোজিন এবং লিনাগ্লিপ্টিন বাজারজাত করেছেন এবং প্রথম দিকেই তারা সফলভাবে একটি সায়েন্টিফিক উপস্থাপনার মাধ্যমে সবাইকে অবহিত করার সুযোগ দিয়েছেন এবং চিকিৎসকবৃন্দকে এই ব্যাপারে অবহিত করেছেন। এর জন্য আমি তাদেরকে সবাইকে একমি ফার্মাসিউটিক্যালকে আমার পক্ষ থেকে আন্তরিকভাবে ধন্যবাদ জানাই। আজাদ স্যার একটা কথাই বলেন যে প্রথম হইতে পারলে ভালো, না হইতে পারলেও লাস্ট হয়েও না। সুতরাং এর কতগুলো অ্যাডভান্টেজ পাবা, প্রথম দিকে যদি ওষুধটা আনা যায় এ ডেফিনেটলি কিছু অ্যাডভান্টেজ পাওয়া যায়। তা এটাও ঠিক, স্যারের আর একটা কথা আমার খুব মনে পড়েন যে উই আর রানিং ভেরি এক্সাইটিং টাইম ফর দ্য ম্যানেজমেন্ট অফ স্পেশালি টাইপ 2 ডায়াবেটিস। আমাদের অনেক ড্রাগ, অনেক আর্মামেন্টেরিয়াম, অনেক আমাদের সুযোগ, অনেক কিছু আছে। ডি ফ্রাঞ্জো সাহেব যেমন 8টা ওষুধ বা 8টা প্যাথোজেনেসিসের কথা বলিয়েছেন, সেই জন্য 8টা ওষুধ দিয়ে ডায়াবেটিসের চিকিৎসা 8টা পর্যায়ে চিকিৎসা করা যাইতে পারে। কিন্তু একটা মানুষকে 8টা ওষুধের বার্ডেন এবং এর কস্ট বিয়ার করা বা এটা টলারেট করা তো অত ইজি হবে না। এটার মূল প্যাথোজেনেসিস এখনও সম্পূর্ণভাবে তার মানে অনাবিষ্কৃতই। প্রফেসর ফারুক পাঠান স্যার তার বক্তব্যের প্রথমে এটা বলেছেন। স্পিকার, আজকের দুজন বিজ্ঞ স্পিকার খুব ভালোভাবেই ড্রাগ দুইটার সম্বন্ধে ইন্ডিভিজুয়াল তাদের অ্যাডভান্টেজ, ডিসঅ্যাডভান্টেজ এবং তাদের কার্ডিওভাস্কুলার এবং রেনাল প্রোটেক্টিভ ক্ষমতা সম্বন্ধে ডিটেলসভাবে বলেছেন। এই ব্যাপারে আমি আর বলে এই দুপুরবেলা আর কাউকে বোর করতে চাই না। কিন্তু যে জিনিসটা যে প্রত্যেকটা ওষুধের একটা নিজস্ব দৃষ্টিভঙ্গি, নিজস্ব এর উপকারিতা যেমন আছে, প্রত্যেকটা ড্রাগের কিছু অপকারিতাও আছে। বোথ দ্য ড্রাগস ওয়েল টলারেটেড। লিনাগ্লিপ্টিন তো খুবই বেশি, মানে ইন কম্প্যারিজন টু এম্পাগ্লিফ্লোজিন বেশি টলারেট করা যায় বা এর সাইড ইফেক্ট খুবই কম। এম্পাগ্লিফ্লোজিনের কিছু সাইড ইফেক্ট যেহেতু আছে, সেহেতু সেগুলো খেয়াল রেখেই আমরা ওষুধটাকে ব্যবহার করছি এবং করব, সেই ব্যাপারে আমরা সবাই অবহিত আছি। আমি আর বেশি বক্তব্য আমার বাড়াবো না এই ব্যাপারে, শুধুমাত্র আমি এইটাই বলবো যে আমার এটা রেশনাল ইউজ করতে হবে। তবে সবাই হয়তো এটা অ্যাফোর্ড করতে পারবে কিনা সেটাও আমাদের দেখতে হবে। আমাদের যদি অ্যাফোর্ড করতে পারে, দিস ড্রাগ হ্যাজ ইউনিক অ্যাডভান্টেজ ইন কার্ডিওভাস্কুলার প্রোটেকশন অ্যাজ ওয়েল অ্যাজ কার্ডিওভাস্কুলার সেফটি অ্যান্ড বেনিফিট অলসো, এবং রেনাল বেনিফিটও আছে। আবার হার্ট ফেলিউরে আমাদের এটাও অবশ্যই। আমাদের ওয়েট নিউট্রাল ড্রাগ, হাইপোগ্লাইসেমিয়া কম করে। আমরা চিকিৎসা করতে গিয়ে যেই সব প্রবলেম ফেস করি এবং যেই সব উপকারিতা আশা করি, তার প্রত্যেকটাই দুইটা কম্বিনেশনের মধ্যে আমরা পাই। সুতরাং এটা ইফিকেসি, সেফটি, টলারেবিলিটি, কার্ডিওভাস্কুলার, রেনোভাস্কুলার এবং অন্যান্য সব কিছু যদি চিন্তা করি, দিস ইজ ইউনিক কম্বিনেশন। মোরওভার ডক্টর ফারিয়া আপা এবং অন্যান্য এক্সপার্টরা বলেছেন যে এটা পিল বার্ডেন কমাইলো, কমপ্লায়েন্স বাড়াইলো এবং আমাদেরকে এতে রোগীর চিকিৎসাতে আর একটা অবশ্যই সব দিক মিলে এটা হেল্প করবে। থ্যাংক ইউ ভেরি মাচ ফর গিভিং মি দ্য অপরচুনিটি। থ্যাংক ইউ একমি অ্যান্ড দ্য অডিয়েন্স। থ্যাংক ইউ ভেরি মাচ।
Thank you so much, sir, for your brilliant speech. Now, I would like to invite our honorable special guest, Professor Mohammad Farooq Pathan, sir, Director, Bardem Academy, to say something about today's scientific topic.
আসসালামু আলাইকুম। আমি আমার প্রথম বক্তব্যে বলেছিলাম যে এটার অবজেক্টিভটা কী। একটা হলো কস্ট কমানো, একটা হলো কমপ্লায়েন্স অ্যাডহারেন্স বাড়ানো। আর একটা দিক হলো কম্বিনেশন যখন করতে যাচ্ছি আমার কমপ্লায়েন্স অ্যাডহারেন্স কস্ট কমানো হিসাব চিন্তা করে, তো হুইচ কম্বিনেশন ইজ বেস্ট ইম্পর্টেন্স। এখানে কম্বিনেশন হবে আপনি ম্যাটফর্মের সাথে আদার কম্বাইন্ড ড্রাগ মার্কেটে আসছে। আর হোয়াই দ্য লিনাগ্লিপ্টিন অ্যান্ড অ্যাজিলেট টু কম্বাইন করা হলো। যদি আমি পিছন দিকে তাকাই, যেটা আমি অলরেডি বলেছিলাম, অ্যামিনো অক্টেট পাথওয়ে অনেকগুলি ড্রাগ লাগে, অনেকগুলি পাথওয়ে আছে ফর দ্য ডিফেক্ট হাইপারগ্লাইসেমিয়া হওয়ার জন্য। কোন ডিফেক্টটা ইম্পর্টেন্ট আমাদের কাছে? ডেফিনেটলি বিটা সেল ডিসফাংশনটা ইম্পর্টেন্ট বেশি আমাদের কাছে গণ্য হিসাবে আসে। তার সাথে আমার আলফা সেল গ্লুকাগন লেভেলটা ইম্পর্টেন্ট, ইনক্রিটিং অ্যাক্টিভিটি ইম্পর্টেন্ট। সো ইনক্রিটিং অ্যাক্টিভিটিকে ইমপ্রুভ করার জন্য, প্রিজার্ভেশন অফ বিটা সেল ঠিক রাখার জন্য এখানে Dpp4 ইনহিবিটর যা ইনক্রিটিং মাইমেটিক ডাক ইজ ইম্পর্টেন্ট। যখন ইনক্রিটিং মাইমেটিক ডাক কথা চিন্তা করি, তো যদি এথনিসিটি চিন্তা করি থ্রুআউট দ্য ওয়ার্ল্ড, যে আমাদের এশিয়ান এথনিসিটি, সাউথ এশিয়ান এথনিসিটি, ককেশিয়ান এথনিসিটি, দেখা গেছে যে স্টাডি যেগুলি আছে ককেশিয়ানস অ্যান্ড হোয়াইট অ্যান্ড ব্ল্যাক পিপলের ভিতরে বা ইন্ডিয়ান সাবকন্টিনেন্টের ভিতরে, এবং দ্য এথনিসিটি হিসাবে চিন্তা করলে মোর ইফেক্টিভ ড্রাগ ইন দ্য এথনিসিটি হিসাবে ইন আওয়ার কান্ট্রিতে Dpp4 ইনহিবিটর একটা ইম্পর্টেন্ট বিষয়। যদিও দের ইজ নো ডিফারেন্স বিন দ্য হোয়াইট অ্যান্ড আমাদের এশিয়ান পিপলের ভিতরে আপনার SGLT2 খুব একটা ডিফারেন্স নাই, কিন্তু Dpp4 একটা ডিফারেন্স আছে। আমাদের এথনিসিটি হিসাবে আমরা বেশি ইফেক্টিভ কাজ পাবো এখানে। সেকেন্ড পয়েন্ট হলো, যখন কম্বাইন্ড ড্রাগ ইউজ করবো, কেন ইম্পর্টেন্স করবো, কারণ হলো তো এটা উই হ্যাভ মাস্ট বি ভেরি মাচ অ্যাগ্রেসিভ ফ্রম দ্য বিগিনিং। এটা রুজদা অলরেডি বলেছে, যত অ্যাগ্রেসিভ হতে পারবে আপনার বিগিনিং, তত মেটাবলিক মেমোরিটা অত ভালো হবে, অ্যান্ড ইট মেনটেন দ্য প্রিজার্ভেশন অফ দ্য বিটা সেল অ্যান্ড ড্রাগ ফেলিউর কম হবে। সে চিন্তা করে যদি আমি এডিএর দিকে তাকাই, তাহলে দেখা যাবে যে যদি ওরা বলা আছে যেটা কম্বাইন্ড ড্রাগ অ্যাগ্রেসিভলি কখন করবা, যদি মেটফর্মির পরে যদি কম্বাইন্ড ড্রাগ ইউজ করতে হয়, তো আমি লুক অ্যাট দ্য HbA1c। যদি HbA1c টার্গেট লেভেলে, আমি বলি না 7%, এক একটা রোগীর জন্য এক একটা টার্গেট লেভেল থাকে। ইফ ইট ইজ মোর দেন 1.5 to 2% অফ দ্য টার্গেট অফ দ্য ইন্ডিভিজুয়াল, আফটার মেটফর্মিন you must add another drug or combine drug together in even the initial stage. So in stage the metformin, the second drug do chinta kori, if the HbA1c 1.5 to 2% of the target level, best combination treatment holo linagliptin or the Dpp4 inhibitor with SGLT2. যেহেতু আমরা অন্য কোনো ড্রাগ পাচ্ছি না SGLT2 সাথে আমার Dpp4 inhibitor কম্বাইন্ড ড্রাগ, সেটা linagliptin হলো ইম্পর্টেন্ট ইস্যু হিয়ার। আর linagliptin আরেকটা পয়েন্ট হলো, দুই কার্ডিওভাস্কুলার পয়েন্টে চিন্তা করি, ক্যারোলিনা স্টাডি বা কার্ডিওলিনিয়ার স্টাডি চিন্তা করি, কার্ডিওভাস্কুলার সেফটি পয়েন্ট থেকে আমার এখানে একটা ইম্পর্টেন্ট বিষয় linagliptin ক্যান গিভ ইট, অ্যান্ড রেনাল সাইডটা তো জানি আমরা, এটা সেফটি পয়েন্ট খুব ভালো। অন দ্য আদার হ্যান্ড SGLT2 আমরা জানি যে কার্ডিওভাস্কুলার সেফটির পয়েন্ট থেকে ইম্পর্টেন্ট, বেনিফিট ইম্পর্টেন্ট। শুধু এস্টাবলিশ কার্ডিওভাস্কুলার ডিজিজ না, হার্ট ফেলিওর থাকলে আমি দিতে পারি, যেখানে হার্ট ফেলিওর, এস্টাবলিশ কার্ডিওভাস্কুলার ডিজিজ, ওবেসিটি থাকবে, হাইপোগ্লাইসেমিক টেন্ডেন্সি বেশি থাকবে, রেনাল ফাংশন ভালো থাকবে, সেখানে গুড কম্বিনেশন হিসাবে আমরা এখানে SGLT2 এবং linagliptin ইউজ করতে পারি। কখন ইউজ করবো সেটা ইম্পর্টেন্ট বিষয়। আমি কি দুপুরবেলা ইউজ করবো, না সকালে ইউজ করবো, না রাত্রে ইউজ করবো। ইফ আমার ফেভার আমার রেনাল প্রোটেকশন যদি থাকে, EGFR মোর দেন 30 থাকে, সেক্ষেত্রে আমার কার্ডিওভাস্কুলার এস্টাবলিশ কার্ডিওভাস্কুলার ডিজিজ, হার্ট ফেলিওর থাকলে আই ক্যান ইজিলি স্টার্ট দিস ড্রাগ ইন দ্য মর্নিং, হাফ অ্যান আওয়ার বিফোর যদি আমি ব্রেকফাস্টটাকে দিই। linagliptin বেলাও তাই, আমার হাফ অ্যান আওয়ার বিফোর ব্রেকফাস্ট, SGLT2 তাই। So best combination these two drug can be given before breakfast, it will be more benefited to us. So এই কথাটা বলে আমি শেষ করছি। ধন্যবাদ সবাইকে।
Thank you so much, sir, for your informative speech. Next, I would like to invite our today's chairperson, Professor Dr. Firoz Amin, sir, Head of the Department Endocrinology, Bardem General Hospital, for his valuable speech about the newest option to treat diabetes.
Assalamu alaikum. In fact, it's a great honor for me to be here for this beautiful scientific session, and from the ACME pharmaceutical company for this combination drug. And what we really face the problem whenever we want to treat a diabetes patient, and after the ominous octet, we have to add so many drugs in our patients, thinking in the mind, blocking the pathophysiological changes in the diabetes patients. So there is a main complaint was from the patient side, there are multiple drugs, but what we understand that we have to add some other drugs for prevention of the disease progression. So after coming these two drugs, linagliptin and SGLT2 inhibitor combination, from our side that will be very helpful, that we can add another drug, but the patient is getting the benefit of two drugs. And from the patient side, the patient will be benefited from their cost. The cost will be limited. The another thing that adding this drug, what we understand from the lecture from the Dr. Rehana and Dr. Rushda, beautiful case discussion, that what you understand that the patients, the complication will be prevented if we start the patient early in our diabetes management. And also Professor Farooq Pathan sir very importantly highlighted that the initial management is very much important. So whatever we want to treat our diabetes patient, first time should be very aggressive for the prevention of the complications. And it is really an honor for us today that our chief guest, Professor Farooq Pathan, Professor Ajad Khan sir is with us. And it is really an honor for us because in every program, whenever sir is with us, our motivation becomes more stronger for diabetes management. So thank you, sir, for being with us. Also, thank you for our special guest of honor, and all the panel of experts, and all the audience, and also for my endocrine departments, all the students. And thank you very much, and especially thanks to ACME for arranging such a nice seminar. Thank you. Thank you all.
Thank you, sir, for your wonderful speech. We have come to the very last part of the session. Thank you so much, the ACME Laboratories Ltd, for introducing such a time-demanding and unique combination for diabetes management. Now, to continue with the rest of the program, I am requesting the host to take over. Thank you.
Thank you, Dr. Parijat Ghosh, for your wonderful session. The epidemic of diabetes is as a result of the lifestyle changes that has been forced upon our people. In today's elaborate discussion, we got to know the breakthrough unique combination of Empagliflozin and Linagliptin for diabetes management. This is to help our patient in order to combat diabetes with the game-changing combination, which provides end organ renal protection. The ACME Laboratories Ltd is one of the largest pharmaceutical company in Bangladesh, which has a good reputation all over the country for making world-class and top-quality pharmaceuticals, including oral pioneer anti-diabetic medicine since the very beginning. Starting from the first oral GLP-1 analog to today's unique combination, which is Empagliflozin and Linagliptin, ACME takes the pride to launch the breakthrough unique combination with the brand name Emlino, first time in Bangladesh. Inshallah, we'll work together for advancing our shared values and promoting secure, stable, and well-planned treatment with one-of-a-kind combination to defeat diabetes together. Now I'm requesting all the special guests, Dr. Ashrafuzzaman sir, Firozamin sir, Farooq Pathan sir, and our National Professor A.K. Ajad Khan sir to join us on the stage for a memorable photo session with Emlino. Please, sir, come up on the stage. Now, with the permission of the respected chairperson and chief guest, I would like to invite our respected chief guest, Ajad Khan sir, to say a few words for us.
আমার তো তেমন বলার কিছু নাই, বলার হলেই যে একমিকে এবং আমাদের যে কলিগ যারা এখানে আছেন সবাইকে ধন্যবাদ। আই থিঙ্ক আমি মনে করি যে এই কম্বিনেশন একটা প্রপার কম্বিনেশন, এটা ইউজফুল, এবং এই মিটিংয়ের মাধ্যমে আমরা আমাদের নলেজকে ঝালাই করে নিতে পারি। এছাড়াও আমার পক্ষ থেকে আমি আই উড লাইক টু থ্যাঙ্ক স্পেশালি for Samsung launch. I hope this product a great success in Bangladesh.
Thank you so much, sir, for your wonderful speech. Now I'd like to invite our respected GM Marketing, Mohammad Jiauddin from ACME Laboratories Ltd to address the gracious vote of thanks.
Good afternoon and assalamu alaikum everyone. I am really happy and honored to be among the most prominent endocrinologists and diabetologists of our country under the same room and all together. And I would like to thank our esteemed chief guest, National Professor Ikajaz Khan sir, our special guest, Professor Mohammad Farooq Patan sir, our guest of honor, Professor S.M. Ashrafuzzaman sir, and today's chairperson, Professor Firoz sir, for making this program successful. I would also like to thank our panel of experts and all the both the speakers for their wonderful and elaborate presentation on the Empagliflozin and Linagliptin combination product. So and we'll be glad to know that this Emlino comes from such a factory that is UK MHRA approved and TGA approved, and these products come with such quality that is in the abroad of the country. So your patient, inshallah, your patient will get optimum glycemic control as well as in-organ benefit from this Emlino, inshallah. So we will continue our journey with all of you to make this diabetes pandemic control and in a better way in coming days also. Thank you for all your time and patience. Thank you very much.
Thank you so much, sir. Now, with the permission of the respected chief guest and chairperson, ladies and gentlemen, our scientific seminar has come to an end. It's been our privilege to be the host and be amongst the nation's most accomplished physicians. Thank you so much. Have a wonderful afternoon. Thank you.